An estimated 37 million American adults are affected by some form of kidney disease that's considered chronic. Early action is key, and here with guidance on diagnosis and treatment, nephrologist Dr. Jessica Coleman. Good morning.
Good morning. Thanks for having me.
Well, this is an important topic, of course. This is Kidney Disease Awareness Month, and it does heighten our awareness to stop and think about this, because truly, unless we have a problem, we don't think about the health of our kidneys.
You're exactly right. And honestly, oftentimes chronic kidney disease is silent, so there wouldn't be any external reason for you to suspect that you had chronic kidney disease until, unfortunately, it had progressed quite significantly. So it's a very important topic to discuss, and early detection is key.
And what are we talking about specifically? What sorts of ailments that affect our kidneys?
Well, when we think about people who are at risk for kidney disease, we're thinking about folks with other very common chronic medical conditions. Things like diabetes, hypertension, heart disease. These folks are at increased risk for chronic kidney disease, or CKD for short. And with chronic kidney disease, we think about the normal functioning of kidneys as basically being a filter to strain the blood and remove excess toxins and waste products from our system. So, of course, when that disease process progresses, we see that normal functioning is compromised. One of the common complications, if you will, is hyperkalemia, which is just a fancy way of saying a high potassium in the blood. And like chronic kidney disease, it also can be silent, and unfortunately at times one of the first symptoms of hyperkalemia may actually be death. So again, getting awareness out there, getting the information out there, and helping people to better understand what kidney disease is and how to not only identify it, but also potentially treat it is really very important. And so I appreciate you taking the time to kind of talk to me about this and for me to share some of my experience.
Well, with heart issues and diabetes, big issues in the tri-state here, this could be life-saving advice. So what do you advise your patients to do? What's in our power to control?
So it's actually pretty easy. The first thing that patients can do is just to make sure that they're doing their routine annual physicals with their primary care providers or their healthcare professionals. The diagnosis of kidney disease is actually fairly simple. It's 2 lab tests, 1 blood test, 1 urine test, and these are incorporated into a routine annual physical. The blood test is going to give us an estimation of what we call the glomerular filtration rate. Big $20 word. We used to kind of shorten it down to GFR. That not only tells us what your kidney function is, but it allows us to stage your potential kidney disease. And then the urine test is looking for the evaluation of protein in the urine, which should not be there. So those 2 lab tests coupled together can not only identify kidney disease, stage it, and give us some information as far as prognosis, but allow your healthcare provider to work hand in hand with you to basically work to prevent the progression of kidney disease.
Can we have any impact on the health of our kidneys with our diet, exercise, our own lifestyle choices?
Absolutely. So, you know, I always tell my patients that the basement, in other words, the starting block of the treatment regimen is always going to be diet, exercise. You know, you'll never hear a doctor say not to eat right, move around, exercise, right, drink water. But, you know, at the end of the day, we also know that unfortunately for patients, it can get a good bit more complicated than that. So that's always going to be a good foundation or a basement level initiation. And then again, identifying if there's a disease or a risk present, and then working with your doctor to evaluate a treatment regimen that may be appropriate. Again, like I say, not only to prevent the kidney disease from progressing, but some of the more severe and at times recurrent complications like hyperkalemia or having a high potassium level in the blood.
Can you send our viewers to a website where they can learn more?
I'd be happy to. So the website that I most commonly recommend to patients is called unfilteredkidneyconversations.com. Again, that's unfilteredkidneyconversations.com. Not only does it provide a good starting block of information and education and resources for patients to raise awareness about chronic kidney disease, but it also allows a nice platform where other CKD or chronic kidney disease warriors can share their journey, share their path, and allow for patients to feel like they have a community and have a better understanding of how to attack their own health care and better advocate for themselves.
Thank you, Dr. Coleman. Appreciate this information.
Well, thank you so much for having me, and thanks for helping raise awareness.
Of course. More local lifestyles right after this. Stay with us.